We've all heard this phrase, let food be thy medicine. But is that what doctors think as well? Most physicians will tell you, rightfully so, to eat less or eat more plants or eat less sugar, eat less in general. All of these are true. But what happens when you challenge a physician to really dive deep and think about what is an ingredient or food that you can add to your diet to make you be healthier? So, with me today is Dr. Desarden. She is an internal medicine specialist in Wisconsin. So, tell me a little bit about what's an illness, a condition, what causes it, and how do you usually treat it?
So I would say the biggest issue would be diabetes. I kind of box diabetes with high cholesterol and high blood pressure, and I call them the trifecta because they can kind of be the basis of what causes heart disease, which is still our number one killer. But I would say diabetes is kind of like the biggest preventable medical condition and the biggest contributor to heart disease. Usually we treat it with oral medications. If people progress further, people give themselves injections with insulin. Ideally, the patients who do the best are the ones that can get their diet under control and who exercise regularly.
So what's your food prescription for us?
So this is a food that I discovered in the last 3 or 4 years, and that is chickpeas. I'm just in the last couple of years discovering all the benefits from it. So that's my food prescription.
So what are some of those benefits that you see which a chickpea, something so small and so simple, contains, which would potentially prevent or help with symptoms of the illnesses that you see, some of those metabolic syndrome situations?
The American diet in general, I would say, is very carb heavy. So we try to encourage diabetics to have more protein in the diet. One, because it helps keep you full longer and your body does not break it down into sugar. Chickpeas are a starch. It helps to decrease the spikes in sugar when you're eating foods. So it helps to lower your sugar overall. The other thing is that since it makes you full faster, you're not eating as much, which is always good. It's high in fiber, which is recommended to have about 30 grams of fiber in your diet, and a cup of chickpeas has about 12.5 grams, so you're getting a good amount of your fiber. The fiber is good because, one, it helps prevent the absorption of cholesterol, so it can lower your cholesterol. It also helps to decrease the inflammation in the gut, which can lead to constipation. It can lead to a lot of bloating. The other thing is that it's low in sodium and high in potassium, and this is a great combination to combat high blood pressure. So with just one type of food, you hit all three of the diseases that are the most common ones that I see. So it's working really hard to keep you healthy.
You did a bunch of research into the chickpea, the garbanzo bean, and you found a whole bunch of other stuff that you thought was kind of important to highlight. Do you want to touch on those?
Chickpeas are chock full of vitamins and minerals. I'm going to refer to my list here because there's just so many for me to know off the top of my head. 1, loads of calcium, great for osteoporosis. 2, loads of iron and vitamin C, which the combination is great for anemia, and the vitamin C, of course, is an immune booster. 3, vitamin E. Everyone wants to have nice skin. It helps with that. Tons of B vitamins, good for hair and nails. It has selenium, which is an antioxidant, which actually helps for prevention of colon cancer, and again, helps with gut inflammation. And then choline is another mineral or chemical that helps with memory, brain function, and muscle function. So overall, it just helps from head to toe.
Are there any contraindications? Are there any situations in which I shouldn't be eating a lot of chickpeas?
Yes. So one thing, because it is a starch, it is not good for patients who have irritable bowel syndrome. Patients with irritable bowel, they kind of have like a discoordination of their gut. The other thing is for people with chronic kidney disease, it is high in potassium, and people with chronic kidney disease should have like a low potassium diet. And the other thing is rich in vitamin K. So if there's any patients that are taking Coumadin, this can negate the effect of Coumadin, which is a blood thinner, which we use for a bunch of things, clots, atrial fibrillation. It's more a common medication that older patients take.
Gotcha. Good to know. Thank you for that. So if I was to go to a store, do I just pick up a can of chickpeas? Do I pick up a bag of chickpeas? Do you have any recommendations on how to navigate that?
So the best way to get your chickpeas is a bag of dried chickpeas. But this is kind of time consuming because you usually have to soak it in water overnight to soften it up. So a lot of times we get it from a can. Now you should be careful with the canned ones because there are some that have only 120 milligrams of sodium and there's some that have 400 grams of milligrams of sodium. So definitely rinsing it is going to help get a lot of it off. But if you can find the brands that have less sodium, that's always going to be best.
What is your favorite way to eat chickpeas?
Okay, so I would say two favorite ways. One is a traditional chickpea curry. Because I'm trying to have a low carb diet, I'll take the chickpea curry and I just throw it on a bed of lettuce and voila, dinner. And it's so filling. Like I honestly need just like 2 or 3 heaping spoonfuls and it does the trick. And then with the lettuce, it's nice roughage. It just keeps me nice and regular. That's just the truth. the second, the second way that I like it is this like Middle Eastern recipe that we use with a bunch of different spices, and we just throw it on a pan with some olive oil, put it in the oven, and it's kind of more roasted and crunchy. It's almost like the crunchiness of popcorn, except way better for you.
I love it. And it's such a versatile ingredient. A lot of my clients that I work with and that I focus on are older adults. And I know I take care of my parents, my grandparents. And that sounds like it's something that would be really good to have included in their diet. A lot of those key things that you hit, it's good for brain function, it's good for anemia, and I love the bioavailability of it, the vitamin C plus the iron, that combo. That's so great. That's so cool. Thank you. So Dr. Desarden, thank you for accepting the challenge, for being on this video in this crazy time where, we're doing this over Zoom.